Hi everyone. Welcome to RSB Healthcare Consulting. Telemedicine billing requirements your medical practice should be aware of. Despite the growing prominence of telehealth amid the coronavirus pandemic, medical billing for telemedicine can be complicated. While the federal government, state Medicaid programs, and private insurers have all expanded their telemedicine coverage during the pandemic, Medicare, Medicaid, and commercial payers all have different rules when it comes to billing for telemedicine. Many providers who offer telehealth services rely on a cash-pay-only approach. As such, there's no set of one-size-fits-all advice for providers looking to grow their telehealth services list. That means that sorting out the details of medical billing for telemedicine will continue to be a challenge for healthcare practices. Here are a few essential tips that can help them navigate the evolving reimbursement environment without incurring issues. Get friendly with GT Modifier Telehealth Codes. Medicare covers telemedicine services and reimburses them on the standard fee schedule. Use the appropriate CPT code with the GT modifier to indicate the interactive telemedicine component. Don't let the similar GQ modifier, for asynchronous communications, trip you up, that one's only intended for providers and demonstration projects in Hawaii and Alaska. Similar for Medicaid, but different to identify, track, and reimburse for telehealth services. Providers can select from a variety of HCPCS codes, P1014 and Q3014, CPT codes, and modifiers, GT, U1UD, but medical billing and coding guidelines depend on their state's rules. At present, 48 states and the District of Columbia now provide some form of Medicaid reimbursement for telehealth services. For private payers, it's a state-by-state basis. States have had to create their own requirements when it comes to telehealth, and at last count, 37 states and the District of Columbia have some kind of private payer policy. Research whether your state is one of the 37 with a telemedicine parity law, which mandates commercial coverage of telehealth services the same as in-person ones. But as always, read the fine print. Some states have restrictions. The Big Five have you covered. Aetna, Humana, Blue Cross Blue Shield, Cigna, and United all offer some degree of coverage for telemedicine, but it's policy dependent, meaning many exclusions on lower tier plans, and varies state by state. If you or your patient need specifics before a telehealth session, be sure to verify carefully. When in doubt, check the advice. To verify carefully is even more important when it comes to smaller commercial payers. Go beyond a basic eligibility check to asking an actual representative about the telemedicine CPT code in question. If the rep says it's covered, try to get that statement on record, with a reference number or other form of documentation, to dodge any potential billing disputes down the road. Stay informed. Telemedicine is growing in popularity for more than just underserved populations due to the COVID-19 crisis. Thanks to advances in technology and the changing expectations of patients, telemedicine is increasingly being utilized by providers and accountable care organizations to bolster primary care delivery and keep consumer costs down. Watch for pilot programs in your area and stay engaged with the evolving laws. More positive telehealth program results will ultimately lead to stronger coverage and better reimbursement rates across the board. Thank you for your time. Contact us to collaborate on our email info@rsbhealthcareconsulting.com or our website www.rsbhealthcareconsulting.com.